Yeah. Good morning. Let me quickly drop this information before I disappear for the rest of the day. I was having a conversation with a friend yesterday. He was asking about why diseases, why infection don't actually proceed at the same time. Let's say two people are infected together, and the onset of the symptoms are kind of different between those individuals. So I needed to talk to him about what we refer to as incubation period, and I quickly say, let me quickly drop it now. So within the time you contract a disease, within the time the infection starts and the time the symptoms start showing, that's what is called the incubation period. It's actually a little bit complex, and it doesn't actually follow the same well, in individuals it doesn't follow the same pattern. So let me break it down. When mosquito bites somebody, and within that time and the time the person starts seeing the symptoms, that's what we refer to as the incubation period of a particular disease. Now, the incubation period of a disease depends on a lot of factors. The number one thing is your immune system. How strong is your immune system? If your immune system is good, well, the incubation period might actually be, should I say, might not really be immediately. It might take like weeks. Then for some, let's say, okay, yeah, it also depends on diseases. It depends on disease. For diseases like foodborne infection, takes just, it might be within hours, depending on the organisms, or depending on whether the organism is releasing toxin. So that's for foodborne infection. For diseases like HIV, the incubation period might be years. So the incubation period depends on the organism, your immune system, the infectious dose. The infectious dose is actually very important. How many of these infectious dose of the organism gets into your body. Then it depends also on, apart from infectious dose, it depends also on, should I call it what? It's like a co-infection. Yeah, co-infection. The co-infection. If you have some other infection within your system before another one gets inside it, so we believe that the infection you're fighting is already giving your body, should I call it, has already lowered your immune system to a certain extent. So other diseases that comes in might actually proceed at a faster rate. So it doesn't follow. It's although in some literatures we have some people who says that, okay, incubation period is between so time and so time. It varies amongst individual. It varies among, should I call it, even among locations. If for instance, if a place is mosquito is a mosquito infested area, like maybe you are getting bitten by more than one or two or three mosquitoes at the same time, you don't expect the onset of the malaria that will set in to be the same with somebody who is just maybe getting bitten by a very stubborn mosquito, just one per night. You that you're getting bitten by, let's say, 10 mosquito per night, giving you loads and load of plasmodium, then you of course the malaria, the onset of the malaria fever will be faster in you than the other person. So let me just, that's just the information I want to drop. So most diseases, maybe along the line, we'll talk more about incubation period of some diseases, but just have it at the back of your mind that these things, they don't proceed at the same time. The disease onset don't proceed at the same time. Even the symptoms are different, but that's a talk for another day. So good morning, see you.